Welcome to the deep dive. Today we're tackling something you might notice in your dog or cat that looks, well, a bit strange. Hypermetria and dysmetria.
That's right.
You shared some really interesting info on this, and our goal today is to really dig into what these movements mean, what might be causing them, and, why it matters for you as a pet owner.
Okay, so dysmetria. Well, at its core, it's about incoordination. The animal's trying to move, but they just can't quite judge the distance or the force needed. It's like their internal ruler is off.
Off, yeah. And hypermetria is a specific type of that.
Exactly. Hypermetria is that classic overreaching movement. You see those really exaggerated high steps, almost like goose stepping.
That goose stepping image is really clear.
It is. But it's good to remember dysmetria is the bigger umbrella term. It covers that overshooting hypermetria, but also undershooting, though that's maybe less dramatic visually.
The overshooting is what catches your eye.
Yeah.
So what's happening in the brain usually to cause this lack of smoothness?
Well, the main player here is usually the cerebellum. It's like the brain's coordination center.
Okay, the coordination center.
Yeah, it doesn't start the movement. That comes from elsewhere, but it's absolutely crucial for refining it, making it smooth, accurate, keeping balance in check, too.
So if that coordination center, the cerebellum, is damaged, what happens then?
You get that misjudgment of movement we talked about. They can't gauge the rate, range, force properly. What's really interesting, though, is that their actual muscle strength is usually fine.
Still strong, just clumsy.
Kinda. And they still know where their limbs are in space, what we call conscious proprioception. That internal GPS is working. They want to move right. But the fine-tuning signals from the cerebellum are getting scrambled.
That's a great way to put it. Scrambled signals. Now, you mentioned usually the cerebellum. Our sources also hinted it's not always the brain, sometimes the spine.
That's right. Less common, definitely, but yes. If you have pressure on specific pathways in the spinal cord, the spinocerebellar tracts,
The spinocerebellar, okay.
you can see similar signs. This seems more likely if the lesion, the problem area, is towards the back, the dorsal side of the cord.
Interesting. And one more thing before we dive into causes in dogs specifically. Inherited conditions, hereditary ataxias, are a pretty significant factor for cerebellar problems, aren't they?
Oh, absolutely. That's a really important category we'll need to cover. Big one for dogs.
Okay, so we have a basic idea. Dysmetria is faulty coordination. Hypermetria is the goose-stepping type, usually involving the cerebellum, sometimes the spine. So what else might you actually see, beyond just the legs?
Good question. Besides the limb issues, you might notice a kind of swaying of the whole body, the trunk. We call that trunkal sway.
Okay, a body wobble.
Yeah. And then there are intention tremors. These are tremors, a shakiness that actually get worse when the animal tries to do something specific, like eat or reach for a toy.
Worse when they try to be precise.
Exactly. You might also see them standing with their feet wider apart than usual, a wide-based stance, trying to get more stable.
Makes sense. Trying to brace themselves.
Sometimes a head tilt can be part of it. And another sign is losing the menace response. That's the blink reflex you test by moving your hand quickly towards the eye.
But their vision is okay.
Often, yes. They see the hand, but the reflex blink controlled partly by the cerebellum isn't working right. And occasionally you might see pupils of different sizes, anisocoria. That's definitely a sign something neurological is up.
Yeah, their pupil sizes would certainly make you call the vet. Okay, let's get into the nitty-gritty. The causes. Starting with dogs. Sounds like a long list.
It really is quite a range. So in dogs, you can have issues right from birth, like cerebellar hypoplasia.
Hypoplasia meaning underdeveloped.
Right, the cerebellum just didn't develop fully. This can be inherited in some breeds, or it can happen if the mother gets infected with canine herpes virus around the time the puppies are born.
Wow, okay. And then those hereditary ataxias you mentioned.
Yes. Things like cerebellar aviotrophy or cerebellar cortical degeneration, these are different from hypoplasia. With hypoplasia, they're sort of born with the smaller cerebellum. With abiotrophy, it develops normally initially, but then cells start to die off prematurely. It's a progressive thing.
So one is underdeveloped from the start, the other degenerates over time. Got it.
Precisely. Then you have genetic metabolic issues like lysosomal storage diseases.
Ah, yes, where the body can't break down certain things.
Exactly. And that buildup affects the brain, including the cerebellum. Then, of course, infections are a big category.
Like what kind of infections?
Well, viruses like canine distemper are notorious. Protozoa like Toxoplasma and Neospora. Even tick-borne things, rickettsial infections like Ehrlichia or Rocky Mountain spotted fever can sometimes cause neurological signs like these.
So viruses, parasites, bacteria,
Yeah.
a lot.
Fungal infections. Cryptococcus is a common fungal culprit affecting the brain. Also, inflammatory conditions, things like GME, granulomatous meningoencephalitis, or just meningoencephalitis of unknown etiology. Basically, inflammation in the brain and its coverings.
MUE, right. We hear about that sometimes.
Yeah. And there's also steroid-responsive Shaker syndrome, sometimes just called Shaker dog disease, mostly seen in small white dogs.
Shaker dogs, okay. Lots of causes already.
And we haven't even mentioned the more structural things yet. Tumors, obviously. Head trauma, vascular events like a stroke, which we call an infarct, or bleeding, a hemorrhage in the cerebellum.
Right, the more direct physical damage causes. And didn't our sources mention something surprising? An antibiotic.
Ah, yes, metronidazole. It's a really common antibiotic and antiprotozoal drug.
Used all the time.
It is, but high doses, usually over 60 milligrams per kilogram per day, can cause these cerebellar and vestibular signs in some dogs. And interestingly, some individuals seem susceptible even at lower doses.
That is definitely one to keep in the back of your mind. Okay, quite the list for dogs. What about cats? Similar picture, or are there cat-specific things?
There's definitely overlap, but some key differences too. For cerebellar hypoplasia in cats,
The underdevelopment one.
yes, that's most famously linked to the mother cat being infected with feline panleukopenia virus, feline distemper, while she's pregnant. The virus attacks those rapidly dividing cells in the developing cerebellum.
Ah, so that's why vaccinating breeding cats is so critical.
Absolutely crucial. Cats also get lysosomal storage diseases like dogs. That's a shared category.
Okay. And viruses in cats. Beyond panleukopenia.
Well, FIP, feline infectious peritonitis, can certainly cause neurological inflammation, and FLLV, feline leukemia virus, and FIV, feline immunodeficiency virus, while maybe not directly targeting the cerebellum typically.
They weaken the immune system?
Exactly. And that immunosuppression can open the door to other infections causing encephalitis, or even increase the risk of certain brain tumors developing, which could then impact the cerebellum.
Makes sense. Secondary effects.
Right. Toxoplasmosis is also a concern in cats, just like dogs. Fungal infections like crypto, yep, cats get those too. And tumors, bleeding, trauma, those general categories apply to both species.
So some unique viral links in cats, but many similar broader categories. Now let's circle back to the spine for a moment. You said spinal cord issues can sometimes cause this, particularly in dogs. When is that most likely?
Yeah, for that specific overreaching gait, hypermetria, caused by a spinal issue, we're usually looking at problems located towards the top and center dorsally in the neck region.
Centrodorsal neck region. Okay. And what kind of problems might happen there?
Well, things like subarachnoid diverticula, these are little fluid-filled outpouchings that can press on the cord.
Like little cysts.
Sort of, yeah. Tumors in or around the spinal cord in the neck, obviously. Certain vertebral malformations, like atlantoaxial subluxation, that's instability between the first two neck bones, very serious.
Found it.
And occasionally, a condition called calcinosis circumscripta, where these gritty calcium deposits form and can press on the cord.
Wow. Calcium deposits. Okay, so it's fascinating how neck problems can mimic brain problems sometimes.
Yep.
Let's talk risk factors. Who's more likely to get these issues? The sources mentioned a lot about dog breeds.
They did. It's quite striking for certain conditions. For hereditary ataxia, the list is long. You've got Gordon and Irish setters, Kerry Blue Terriers.
Lots of terriers seem prone to neurological things.
It seems that way. Airedales, too, Finnish Harriers, Finnish Hounds, Samoyeds, Bernese Mountain Dogs, Cocker Spaniels, Cairn Terriers, Australian Kelpies, Bull Mastiffs, Italian Spinones. It goes on.
Keep going.
Okay. The terrier group generally. Old English sheepdogs, Rhodesian Ridgebacks, Border Collies, Rough-Coated Collies, Brittany Spaniels, Beagles, Scottish Terriers. It really highlights how genetics plays a role in cerebellar health for dogs.
No kidding, that's a huge list. What about cerebellar hypoplasia, the underdevelopment? Any breed links there?
Yeah, that seems to pop up more often in Chow Chows, Irish Setters, and Wire Fox Terriers.
Okay, and those lysosomal storage diseases. Another long list of breeds.
Afraid so. English Springer Spaniels, Amstaffs, Portuguese Water Dogs, German Short-Haired Pointers, Australian Silky Terriers, Shipper Cakes, English Setters, Border Collies again, Salukis, Chihuahuas, Queensland Heelers, Dachshunds, Yugoslavian Shepherds, Tibetan Terriers.
Ew. It really drives home the point about knowing your breed's potential predispositions.
Absolutely. And for that steroid-responsive tremor syndrome, The shaker dogs.
Which ones get that?
That one strongly favors small breed white dogs. Think Maltese, West Highland White Terriers, Bichons sometimes too.
Okay, the little white fluffy ones. Now, back to the metronidazole sensitivity. Any breeds more prone, or is it just random?
The sources mainly point to high dose being the risk factor across the board, but they do mention some dogs are just more sensitive. Doesn't seem strongly linked to specific breeds in the material we reviewed, more like an individual thing.
Got it. Individual sensitivity. What about strokes or vascular events in the cerebellum? Any risk factors there?
Yeah, definitely older dogs are more prone, just like older people. And underlying conditions can increase risk. Anything causing hypercoagulability, making blood clot too easily, like Cushing's disease.
Right, Cushing's.
Or hypertension, high blood pressure. That can come from kidney disease or hyperthyroidism, especially in cats. Interestingly, even low thyroid hormone, hypothyroidism in dogs, has been linked in some reports.
So lots of other health conditions can tie into cerebellar vascular risk.
Exactly, it's all connected.
Okay. Switching back to cats quickly, any breed risks there, especially for those lysosomal storage diseases?
Yes, for lysosomal storage diseases in cats, breeds like Siamese, Balinese, Persians, and just domestic shorthairs have been reported more frequently.
Good to know. And finally, those spinal issues in dogs causing hypermetria, any size or breed links there?
Generally, yes. Those vertebral malformations and instability issues are more common in larger and giant breeds.
Makes sense. More stress on the structures.
Probably. And those subarachnoid diverticula and the calcinosis circumscripta seem to pop up more in young, large breed dogs.
Okay, so size is definitely a factor for the spinal causes. This is incredibly helpful information for owners. So let's say you see these signs, you take your pet in. How do vets actually figure out which of these many possibilities is the culprit? What's the diagnostic path?
Well, the very first thing, honestly, is just observation and the neurological exam. We need to confirm it is neurological and characterize the signs. And sometimes we have to differentiate it from just a normal, maybe slightly quirky, high-stepping gait, especially in some small breeds.
Right, like a poodle prance or something might look a bit like it.
Exactly. If there are no other neurological signs, maybe it's just how they move. But if we suspect a real problem, then the workup begins.
Okay, workup time, what does that involve? Lab tests.
Usually starts there. Basic blood work, CBC, chemistry panel, and a urinalysis. These give us a baseline, look for signs of infection, inflammation, organ issues that could be related. Sometimes, for certain lysosomal diseases, you can actually see abnormal storage material in the white blood cells on the blood smear.
Wow, really?
Yeah, it's quite specific when you see it. Then we might move to more targeted tests.
Like testing for those infections.
Right. We can measure antibody levels, titers for various infectious agents, viruses, protozoa, fungi, rickettsia. Often we need 2 samples, one early on and one a few weeks later, to see if the levels are changing.
Acute and convalescent titers.
Exactly. For some things like toxoplasma or crypto, testing the cerebrospinal fluid, the CSF, can be very helpful, looking for antibodies or the organism's DNA or antigens right there in the nervous system.
CSF, that's the fluid around the brain and spinal cord.
That's the one. PCR testing on blood or CSF is also super useful now. It's very sensitive for detecting the genetic material of infectious agents.
And you mentioned genetic tests earlier for the hereditary conditions.
Yes. For many of the hereditary ataxias in specific breeds, beagles, setters, terriers, sheepdogs, and others, there are direct DNA tests now. That can give a definitive answer for those.
That's huge progress. What about looking inside? Imaging.
Imaging is often key. Chest x-rays might be done, especially in older animals, to check for cancer spread if a tumor is suspected in the brain. Maybe an abdominal ultrasound if we're worried about something there.
But for the brain itself?
CT or MRI is needed. MRI is generally preferred, especially for the cerebellum back in the caudal fossa, the back part of the skull. It gives the best detail.
What can MRI show?
Oh, lots. Tumors, strokes, bleeds, inflammation, signs of encephalitis, cerebellar shrinkage from hypoplasia or abiotrophy.
Yeah.
It's really the gold standard for looking at brain structure.
And if you suspect the spinal cord instead?
Regular x-rays of the neck might show bone abnormalities or those calcium deposits. But, again, for the best view of the spinal cord itself and any compression, MRI is the way to go. Non-invasive and very detailed.
MRI seems like the MVP for neuroimaging. Any other diagnostic procedures?
Well, a fundic exam looking at the back of the eye is part of a good neuroexam. It can show inflammation or vascular changes linked to infections, inflammation, or high blood pressure.
Checking the eyes gives clues about the brain.
Often, yes. And CSF analysis, actually analyzing the fluid itself, not just for antibodies or PCR, is crucial for diagnosing inflammation like meningitis or encephalitis. We look at cell counts, protein levels, and sometimes for specific storage diseases where the liver is involved, a liver biopsy might be needed.
Wow. Okay, it really is a comprehensive investigation. So once you have a diagnosis, or at least a strong suspicion, what about treatment?
Treatment is entirely dependent on the underlying cause. That's the absolute key.
Makes sense. Treat the cause, not just the symptom.
Exactly. The first decision is often about supportive care. Does the animal need to be hospitalized? If signs are severe or progressing fast, yes, for IV fluids, monitoring, maybe intensive diagnostics. Milder cases might be managed as outpatients, but diagnostics needing anesthesia always mean a hospital stay.
And anything owners can do at home, environment-wise.
Definitely. Safety is paramount. Confining them to safe areas, non-slip flooring, blocking stairs, anything to prevent falls and injuries because of the poor coordination.
Practical tips.
Good. But the core of treatment is targeting the cause. If it's an infection, the right antimicrobial or antifungal drug. If it's inflammatory, like GME or Shaker disease, immunosuppressive drugs like steroids.
Okay. What about surgical options?
If there is a compressive spinal cord lesion, like that diverticulum or maybe a tumor that's operable, then surgery to decompress the spinal cord is the treatment.
And that metronidazole issue.
Yes. If metronidazole toxicity is suspected, step 1 is simple: stop the drug immediately. Then you monitor for improvement, which often happens but can take time.
Stop the drug. Got it.
Hmm.
So, after treatment starts, what about follow-up?
Essential. Regular neurologic reexaminations are needed to see how they're responding, if the treatment needs adjusting. And depending on the cause, other things might need monitoring too, like blood pressure if they have hypertension, or follow-up titers for infections.
Constant vigilance.
Pretty much. It often requires ongoing management.
This has been incredibly thorough. So, to kind of wrap up the key takeaways, dysmetria and hypermetria, these coordination problems, they're really signs pointing to something wrong in the nervous system, usually the cerebellum, sometimes the spine.
That's the main message. They aren't diseases themselves, but signs of one.
Right. And recognizing those signs, understanding there's this huge range of possible causes: infections, genetics, inflammation, toxins, injuries, vascular issues, and then the importance of that detailed diagnostic process. It's all crucial for helping our pets.
Absolutely. And I think what's really striking is just how many different things can go wrong to cause these signs. It highlights how complex that system is. Those breed predispositions we discussed are also, really important for owners of certain breeds to be aware of.
Definitely worth knowing if your breed is on one of those lists. So,
Yeah.
thinking about all this complexity, the varied causes, the diagnostic challenges, it really makes you wonder, doesn't it? What's next? What new research might give us better ways to diagnose these conditions earlier or treat them more effectively down the road?
That's the big question, isn't it? Lots more to learn.
Definitely something for us all to think about. Thanks so much for sharing all this insight today. This was a fantastic deep dive.